Hi, we are Cthulhu, Kirsty, Paul, and Bill, and we are a team of software developers from the University of Calgary. Let us introduce you to safedistance. Safedistance is a social networking site focused on connecting COVID patients within temporary treatment facilities. While treatment facilities are essential given the severity of the pandemic, the necessary physical distancing measures take a toll on the mental health of patients. In tiny impersonal rooms, patients are isolated both from their family and friends, as well as from staff and other patients for safety. Patients will have to live in this barren gray box for weeks while they recover with minimal human contact. Isolation is lonely. While we are all struggling with practicing social distancing and stay-at-home guidelines, these feelings of anxiety and loneliness are much worse for those hospitalized. Before COVID-19, 5% of Canadians reported high to extreme levels of anxiety. 5 weeks later, that number has multiplied to 20%. Self-reported cases of depression have more than doubled from 4% to 10%, and that must be much worse for hospitalized COVID patients who have a very real risk of death. So, how do we address this anxiety? By providing patients the chance to connect with those around them, though they may not be allowed to see them in person. Patients will be able to scan a QR code with their smartphone that takes them to safe distance. They will be able to make an account and then interact with people from their particular treatment facility. We wanted to make something with an emphasis on connections within a patient's living space, even when they may not get a chance to interact with other people in the facility as much as they want to. Medical staff can post bulletin messages to patients like, "We are out of toilet paper," or more positive messages like, "Reduction in new coronavirus cases globally." This creates a space to convey news and announcements to patients, share pictures, and just have a central hub for information. Patients also have access to a feature to call medical staff in case they need something like water or blankets. Patients can message others within their facility. Safe Distance fights physical distancing measures by letting patients form connections within their facility. Patients can talk to one another through the chat and get through their stay safely together. As we have shown in our demo, we have completed the functional prototype that is ready to be used. In just a few days, we have the prototype complete. Given a few more weeks, the website could be polished even further with additional features, like guided meditation. Due to the nature of the project, almost no time will be taken to deploy it. It can be deployed and accessible within minutes if the project is greenlit. When it comes to operational costs, we're looking at a total of under $20 per month based on estimated usage from current COVID-19 spread statistics. This includes all operating costs for hosting the website. Since this is a web-based project, it can be accessed by anyone with a smartphone or a computer. In conclusion, our low-cost, ready-to-deploy solution will help build communities within temporary hospital facilities and foster human connection between isolated patients.